For more on this important topic on parenting and preventing such tragedies, we're joined by the National Association of Childcare Workers Director, Donald Nghonyama. Donald, good evening. Thank you very much for your time and for joining us tonight up here on In Focus. It's not a time necessarily to be apportioning blame as the tragedy has just happened, but I understand the minister there saying, no, I didn't come here to nurse emotions, but I came here to speak truth to power, so to speak. Is the minister correct in his analysis and assessment?
Yeah, let me start by saying good evening to you and good evening to everyone who is following this program tonight. You see, it's a difficult thing to say whether the minister is correct or not correct. To some extent, yes. Parents have got the responsibility to ensure that their children are safe, are looked after, and they play in places that are safe, and that there are rules in the family and that they follow the rules. If parents say the child must be home at a particular time, that house rule needs to be followed. But let's face the reality of today. There are so many challenges that our young people are experiencing in these days. Many of the parents find themselves working. If they are not working, they are doing everything they can to make sure that there is food on the table. And children are exposed to a lot of information outside. And we need to also move with times as parents, as professionals, as child and youth care workers. I am speaking to you coming from the National Association of Childcare Workers, as NACCW, and we are an association for child and youth care workers. And we have got a program that we developed, and it is being implemented with the Department of Social Development, who have now taken it over, called ECBND, where we are expecting child and youth care workers to be deployed in communities.
Right.
And the child and youth care workers should be working with the children in communities doing prevention and early intervention. And with what we are talking about here, it's a sign of where early intervention, prevention and early intervention, it's not being promoted.
Yeah.
And,
would you say, Donald, that before we speak broadly on the community participation, but while we sit at the parents, do you think this was a challenge as far as parents are concerned to clearly communicate expectations, so a failure of productive communication? Because we hear that these are youngsters who were celebrating end of exams of some sort, and these are the things that they do quite regularly and gather at such places. When you look at it, would you say it's a failure of communicating? Because I don't think parents necessarily have an expectation that my child, when they finish exams, they're going to go and party at a tavern until 3 a.m. in the morning. So clearly, there must be a failure of communicating that expectation, that I don't expect you to do that, or there is a degree of a lack of productive communication within the household.
See, I would say that it's a failure of the society. It's failure of community. Because we can see things are changing. We have more and more young people getting involved in taking substances, taking drugs. And communities sometimes, they just allow things to happen. Communities should be coming together, especially when it comes to parenting and adolescence. It's not easy. It requires all of us. We need to ensure that we deploy the right people. We deploy child and youth care workers and social workers in communities so that they can assist these young people to understand what it means to be safe.
Yeah.
Which are the places that they can go and not go. And maybe they might be having these events of pens down, but a trained social service practitioner, a child and youth care worker, and a social worker will be able to guide them to say those are not safe places, and there are better ways of having events such as this. If children had to celebrate end of year the completion of writing half-year examinations. It could be done in different ways. It doesn't have to be at night. It can be done during the day. I think that it is the failure of society. I can't entirely blame it on parents.
Yeah.
We do need to work together to help when it comes to parenting, especially during these times when things are changing.
Yeah. What do you say within your program? How do you equip communities? How do you equip parents who have a question that says, what do you do if you find out that your 13-year-old is engaged in underage drinking?
I'll give you an example. We've got programs that we are running in schools where we are deploying child and youth care workers. And child and youth care workers are able to identify children who may be having challenges. And they can work with these children one-on-one in groups and whole school intervention. And in the information, it's disseminated. They learn about the good and the bad, and we've got programs that we are running. We also do outreach where the child and youth care workers will go to the families of identified children. So that is another part of prevention and early intervention. So when you start engaging with the child, you engage with the parents, and the parents tell you what the problems of the children are. You sit down with the parents and the children and try and find a solution. You see, the one other challenge that our children have, because what we'll say, we do have people in the community who will be able to speak to these children. But a child and youth care worker is trained to work with these children, even troubled children. You know, the interaction comes from a relational approach where the child feels comfortable to speak to the child and youth care worker, opens up, and where the child and youth care worker is not able to assist, they will refer the cases to the relevant professionals. It could be a psychologist, a social worker, whoever. It could be health or whoever will be able to provide that support.
Yeah.
But we have seen the ECBND program working in the years that we have been implementing it with the Department of Social Development. And it's a program that other countries are now wanting it to come to them. You know, why not embrace something like this in our country, something that is starting to work very well in other countries, started here at home.
Yeah. Is this a collaborative approach, I suppose, with the youth care workers and the parents? How do you support the parents to enhance the work of the youth care worker?
It is a collaborative approach. Child and youth care workers work with children in the context of families. So you support the parents. You even educate parents how to handle an adolescent, and you also help the adolescent get exposed to information that will help them to grow in a way that society expects him.
Yeah.
And there are also other professionals that will come in place. You know, you work with the teachers, you work with the local clinics, you work with the local leaders, it could be counselors. The program has proved to work. If we bring it back and we are serious about it, we make sure that it continues to be rolled out in all the communities. We're talking of the district development model now. And that is a perfect district development model where you can place child and youth care workers and social workers in communities to make sure that things like this are avoided. We can't say that they will not happen, but we can reduce these risks.
Nghonyama, appreciate your time. Let's leave it there for tonight. National Association of Child Care Workers Director there, Nghonyama, calling for more.